Let's go ahead and learn everything we need to know about DKA and HHS. I don't usually combine two diseases or two diagnoses into one video, but in this case, they go really well together because they have a lot of really good overlap and they have a few key differentiators that I really want the opportunity to highlight. So let's learn about DKA and HHS. DKA is diabetic ketoacidosis, and HHS is hyperosmolar hyperglycemic syndrome. So let's start off with what are these? Both of these are complications of diabetes. Here's your first difference. DKA is more common as a complication of type 1 diabetes, and HHS is more common as a complication of type 2 diabetes. So there's our first difference. In both of these, the patient has a very high blood sugar level. Here's our second difference. In DKA, the blood sugar level is usually above 250, 300, usually about 3 to 600. In HHS, the blood sugar usually is much higher, is 600 to about 1,000 or even higher. So HHS, the second difference is that DKA will have about a 3 to 600 range, and this is by no means going to be testable, but it would be a fair test question to understand that which one is more likely to have an extremely elevated blood sugar level out of the two. For sure, HHS is the answer because HHS would be way more likely to have a blood sugar over 1,000, and DKA, that's really uncommon. So let's go to the next difference, which is our key differentiator in understanding the difference between DKA and HHS. We said in both cases there's a really high sugar level in the blood. However, here's the key difference. In DKA, there is not enough insulin in the bloodstream. So there is not enough sugar and insulin getting into the cells. In HHS, the cells are getting all the sugar that they need. There's just a ton left over. In both cases, there's a really high sugar level, but in HHS, the cells are getting the sugar that they need. In DKA, they are not. Because in DKA, they are not, the cells go and start breaking down fat, and that is what results in ketoacidosis. HHS and DKA, the official key differentiator is whether or not there's ketoacidosis, whether or not the patient is acidotic. If the patient has a normal pH and there's no ketones, the patient and a very high sugar level, the patient has HHS. If the patient, and in all these cases we're talking where they have underlying diabetes, if the patient has diabetes and has a very high sugar level and has ketones in the urine and is acidotic at pH below 7.35, that makes it DKA. That's the official differentiator is if they're positive for ketones and if they're positive for acidosis. In both cases, they have a very high sugar level. So let's go through it. Hyperosmolar hyperglycemic syndrome. This is where the patient has a really high sugar level, but there's no ketoacidosis. The pathophysiology is that in this case, there's a stupid high sugar level in the bloodstream. And because of that, the sugar holds all the fluid in the blood vessel. Okay, what does that have to do with anything? So the sugar holds all the fluid in the blood vessel, and all of that goes on to the kidneys. Now, the kidneys are supposed to hold on to fluid, but when there's a lot of sugar in the blood, it makes it very difficult for the kidney to reabsorb and hold on to that fluid. So that fluid stays in the kidney and ends up going to the bladder and out into urine. So the patient ends up with extreme polyuria. They end up peeing out a lot and they end up severely dehydrated. Because they're dehydrated, their blood becomes very thick, it becomes very concentrated. And that's what hyperosmolality means. And that's what hyperosmolar means. So that's part of where the HHS comes from. In DKA, the patient also has a very high sugar level, but they're going to have ketoacidosis because of the fat breakdown for energy. And they're also going to have the same polyuria and polydipsia, but it's not going to be as bad as it is with HHS. So they're not going to be as dehydrated as they are with HHS. I do want to be clear in both of these, the patient is absolutely going to be dehydrated. And in a few minutes, when we get to the treatment for both of these is going to have fluid in it. But HHS is going to be a much bigger issue of dehydration. DKA is also going to be a dehydration issue, but not as bad. Hopefully all that made sense, and it's gonna make more sense as we go through the rest of this video. Let's go through the symptoms. Polyuria, that's excessive urination. We already discussed that. That's classic in both DKA and HHS. Polydipsia, the patient's gonna be thirsty because they're peeing out too much. That's classic for DKA and HHS. Polyphagia is more so for DKA. Why? Because in DKA, the body is not getting enough energy, so the body stimulates being hungry to make up for that. So polyphagia is more associated with DKA. I've seen some textbooks that include it for HHS and some that leave it off. I'm going to stay out of it. Fatigue and weakness is going to be common in both, but more so in DKA. Altered mental status is going to be common in both, but neurological issues where the patient is confused or delirious, things like that, that would be more common in HHS. And that is because of the electrolyte imbalances that can happen in HHS, specifically neurological imbalances. Next, we have fruity breath and crucial respirations. This is only DKA. So this will be a really good way for the test, for your test or the NCLEX to point you towards DKA. Fruity breath and crucial would not be common in HHS. Let's move over to diagnostics. How do we diagnose DKA or HHS? It's going to be diagnosed by an elevated sugar level, a history of diabetes, and now we check, and that tells us if they have an elevated sugar level and history of diabetes, they have one of these. Which one is it going to be? Well, if they have acidosis, then it's DKA. If they have hyperosmolality without acidosis and without the ketones, then it's going to be HHS. We're also going to check electrolytes because very often when the sugar gets way off, the potassium gets way off. When the potassium gets off, the magnesium gets off. So it ends up being a whole circus. So we have to keep a really close eye on the electrolytes. Nursing assessment, number one, check for the electrolytes and the fluid and electrolytes, I should say. I don't know which one will be number one and which will be number two. They're both equally important, at least to me, probably to the NCLEX too. So electrolyte abnormalities and fluids, we're going to keep a close eye on those as nurses. We're going to definitely be trending their blood sugar. We're probably going to be checking it every 30 minutes if they're getting insulin or every hour. And even once they're stabilized, we're probably going to still be checking it every 4 hours or so. HHS and DKA are both very often triggered by infection. So we're also going to assess the patient for any sign of infection. Do they have high white blood cells? Do they have a fever? Do they have any source of infection, like a central line or a UT or a Foley catheter, or anything like that? Because HHS especially, but both of these are most often triggered by the patient being sick. Now let's look to the right side of our screen at the nursing priorities. Number one is going to be airway and breathing. Both of these can cause altered mental status and decreased level of consciousness. So in both of these, we're going to have to keep a close eye on their airway and breathing. Remember, DKA is going to have the deep, rapid breathing that's crucial. HHS is not going to have that. We're going to have to keep a close eye on fluid and electrolytes. This is really important because both of these patients can be severely dehydrated, more so in HHS, but both of these can be severely dehydrated. And again, we're going to check their neurological status. This is more in HHS because of the osmolality can mess up can cause cerebral edema and other neurological issues. So we want to be really careful that we're assessing the neurological status. Treatment. Treatment is going to be fluids. For HHS, that's number one. For DKA, number one is going to be fluid and insulin. But both of them, fluid is going to be absolutely key because both of them are going to be dehydrated. HHS, that's going to be a massive part of the fixing it. Both of them are going to need insulin, but in DKA, insulin is just as important as fluids. In HHS, it is not. And I want to be clear on that for test purposes. In HHS, fluid comes before insulin because they don't have an insulin deficiency. They have a lack of fluid problem. In DKA, they have both. They have a lack of fluid problem and a lack of insulin problem. And then the next part of the treatment, because both of these are severe, complicated issues, we want to also fix the electrolytes because in almost every case of DKA and in most cases of HHS, they are going to have those severe electrolyte imbalances, which can in and of itself cause complications that lead to death. Generally speaking, both of these are really complicated patients to fix. Both of these patients are going to end up in the ICU. If you have DKA, if you have HHS, in most cases, these patients are going to be in the ICU. If for no other reason than the fact that insulin is in most hospitals, at least any hospital I've ever worked with, is only going to be a drug that can be given via infusion, via an IV infusion. Those that can only be done in an ICU. Just a fun fact. Anyways, moving on down to the end of this concept map, we have at the bottom client education and complications. We'll start with client education. That is straight off of the diabetes lectures. That's going to be the same education that you're going to give them on how to manage their diabetes is the education that you're going to give them for DKA and HHS, because at the end of the day, these are complications of diabetes. If they don't have the diabetes, they don't have these problems. So all the education you give them is related to managing their diabetes. As far as complications, two major complications. One is cerebral edema. This is much more common with HHS. And the second one is hypoglycemia. This is anytime you give a patient insulin, you're going to have to look out for that complication. Again, both of these are complications of diabetes. Both of these are treated very, very similar, and they both present very similar. Big difference here is even though both of them are dehydrated, pathophysiologically, DKA is also missing insulin. HHS has enough insulin, and DKA is diagnosed by being acidotic with positive ketones. HHS is diagnosed by not being acidotic and not being positive ketones. Both of them have a really high sugar level. Hopefully this is everything you need to do great on your nursing exam, and I will see you in the next video.